According to the CDC, 59 newborns are diagnosed with neonatal abstinence syndrome every day in the United States. With more on what NAS is and details in a newly received $500,000 grant to help Oklahoma women overcome it, we're joined by Taylor Jackson. Taylor?
Rich, the Health Resource and Service Administration grant will be used to provide health care services and support for women currently being held in or recently released from detention centers.
There is a way out that no matter what happens in life.
Recovery programs like the one offered by OSU Center for Health are helping women like Stephanie Wyrick recover from substance abuse. She recently graduated from Women in Recovery, a prison diversion program.
It's pretty intense. You do a lot of education, a lot of therapy classes, and really throughout it, you just build a great foundation to kind of change your life and start over instead of going to prison.
The goal of the grant is to provide pregnant, incarcerated women or those in childbearing years with substance abuse education to help prevent or reduce the risk of neonatal abstinence syndrome, or NAS. NAS is a withdrawal syndrome that happens when a fetus is exposed to opioids. According to the Oklahoma Department of Health, in 2020, there were more than 1,000 newborns that were exposed to substances. 98 of those newborns had neonatal abstinence syndrome. Within a few days of life, an infant with NAS can experience complications such as tremors, low weight, seizures, vomiting, and hyperactive reflexes.
Unfortunately, Oklahoma has led the nation in female incarceration for the last 30 years. And we know that substance use disorders and incarceration rates go hand in hand. So we had applied for this grant and we actually received it back in 2020 when COVID hit. And so we really saw an increase in female incarceration and the repeat offenders into these jails in the rural communities.
Case manager Gina Moore says she and her team ensure pregnant incarcerated women receive prenatal and postnatal care.
We are alerted with lists of pregnant women, as well as being able to make sure that prenatal care continues when they release. It also looks, of course, at substance use disorders and making sure that MOUD is available within the jails, as well as continues if they have an opiate use disorder.
With this one maybe being a little bit more pediatric oriented.
The program serves 6 counties in northeast Oklahoma, which includes Tulsa, Creek, Osage, Okmulgee, Rogers, and Wagner County.
Really noticed within these rural communities is that there's not a lot of maternal health care. We've had a lot of closing of birthing hospitals throughout Oklahoma, and so women a lot of times have to come to larger cities like Tulsa or Claremore to even receive prenatal care, but definitely to deliver their babies.
This provides health care access to counties with little to no prenatal or postnatal care for women.
Women in these rural jails are oftentimes, if they are not able to be treated or if they're pregnant, they're just released back into the community. So there is no help being accessed there.
But there's also an educational component when we're looking at substance use. So we're really proud of the work we've done educationally within the criminal justice system, as well as with doctors, honestly, and just within the general population. We have created community meetings again, where we have noticed that there are a silo of resources in bringing people together.
Musa Peda and Moore say telehealth services are also available for the women.
Family and Children's Services or even OSU can go in and provide these prenatal care. We can actually catch these women, I shouldn't say catch, but we can actually capture these women's needs and be able to provide those needs before they are released from jail.
And so having access to the women that were incarcerated within the rural county jails during COVID, that iPad was a lifesaver. And and our iPad really is for anyone that needs to use it.
So that's why you see the shield here, because that's done on the arm and they want to blind the participant to whether they're getting placebo or the medication.
Representatives from the Health Resource and Service Administration toured the Hardesty Center for Clinical Research and Neuroscience, where research is conducted and then used in the detention centers.
So let's say we see an intervention that really works within these research facilities. We are able to take that research and then apply it to the grants that we're writing for and actually implement. So we're able to hire case managers, therapists, providers who can actually go into the community.
Wyrick is now working at the Hardesty Center for Clinical Research as a peer recovery support specialist. She says since completing the recovery program, she's become a better mother.
I'm a single mom, and so being able to be out here and really learn and be given an opportunity to become a better mother and to build a foundation for them, to get them out of foster care, it was extremely life-changing, and I'm very grateful.
Wyrick encourages other women with similar backgrounds to choose a better path for themselves and their children.
There's somebody that you can talk to. There's a way to work through things, and that you don't ever have to use drugs to change those feelings.
So far, the program has provided prenatal and postnatal care for more than 100 incarcerated women.